Welcome to week 2. This will be the continuation to what we did in week 1. We're going to be advancing things quite a bit in terms of the pressure that we're going to get with the myofascial release techniques. This time we're going to be using either a lacrosse ball or a tennis ball. That's all we will need for this week. I will remind you this is going to be a bit intense. If it was still intense the last week that you practiced week 1 when you were doing the MFR and it didn't subside that much, you may want to stay at week 1 and keep practicing the basics there. Again, I will remind you, you have your whole life ahead of you to solve this problem. This is a 10-week program, and you can finish it in 10 weeks if you're very, very diligent and if your body's receptive to the information, but sometimes it may not be receptive to the information. So I will remind you guys to just, if you can, extend this out a little bit longer. Really emphasize this myofascial release period because it will be fundamental in your progress as you move forward in this program. So, first point that we're going to be attacking will be the tensor fascia lata. This is going to be a hip abductor, and also it's going to be a hip flexor. Again, for people when they're sitting at a desk all day long, these muscles generally tend to get really, really tight. This area right here tends to compensate, and then it will create an anterior pelvic tilt, but then it will again also create lateral shifting compensations, lateral tilting compensations. This is a very common muscle that's tight on people all the time, and it's one that I attack on a fairly frequent basis. Really how we're going to locate it, it's going to be right here at about the 45-degree angle off of your hip. So if I have my ASIS, just locate your bone right here, and then from there all you're going to do is just kind of track your arm downward laterally, almost like if you're going to put your hand in your pocket. You're going to find the tissues right there. We're looking for a dull, achy sensation. The fibers run vertically here, okay? What I want you guys to do is not run with the fibers vertically. So we're not going to roll the lacrosse ball this way. We're actually going to start moving the lacrosse ball this way as we're laying down on the floor. But we're actually not, we're just rolling the lacrosse ball with our entire body. So it's really going to be your whole body doing this when you're laying down. That's going to get you the effect of that release on that tensor fascia lata. So again, we're going at that 45-degree angle. We're going to lengthen this entire side of our body, and that's going to help enable us to balance that lumbopelvic hip complex a little bit better. So what I'm going to do is just lay down here on the floor. In this fashion, I'm going to extend my arm out, my leg out, and I'm going to put the entire weight of my body on top of this thing right here. Okay, this typically tends to be really, really tight on the side that you tend to tilt away from. So I have a tightness and a rigidness right here on this side of my body, and this side generally tends to be a little bit tighter, just simply because the right side of my pelvis tends to be flimsier. But again, this is all individual, and it's all up to you to find this. Again, always think about going to the pain. That will probably usually give you, that intuition will give you the guidance that you'll need to resolve your dysfunctions. Okay, so I'm just going to move here. Oh, I forgot to put the timer. I'll just assume I've been doing this for about 40 seconds. I'll lift this shirt here so you guys can see a little bit better where I'm aiming at. Again, it's just like that little spot. It'll be a little pocket of tissue that you want to aim at. If this is really, really sensitive, just make sure that you start with the tennis ball. Don't advance straight to a lacrosse ball. This will be really, really painful. So just go with that tennis ball or the lacrosse ball. Strum the tissues back and forth horizontally, as I was showing you before. The tissues run vertical, so you want to move all this stuff side to side. Try getting your breathing in. Try relaxing as much as you can. Some of you may have just gotten off of work and you're trying to just unwind after a hard days of work and a lot of stress. Try just relaxing your mind a little bit. It's kind of just melting into the ball. Also facilitate a little activation of the glutes on the backside, just kind of squeezing the glute a little bit. Dropping that tailbone under, doing that posterior pelvic tilt. Okay, I'll switch sides. Be going here, laying on my side again. Extending my bottom leg out, bringing my right leg forward here. Extending my arm out. And then putting my pressure right there at that same point. This leg here is just simply put so I can lift my body off the ground. And there is a given reason I follow this exact same sequence, guys. I follow the sequence because it tends to, this is how gravity, from what I've seen, tends to orient the dysfunctions. So follow this in order. Don't skip the steps. There's a reason I designed the program like this. Do it like this for a period of about a few months. Every time that you practice what you do, even while you're doing the corrective exercise, you're not going to stop doing your myofascial release. Just follow this order for at least 2-3 months. Then you're going to find the areas that are more restricting to you, restrictive to your movement, whether it may be your left gluteus medius, your left glute max. You can start attacking individually what's wrong with your body later on down the road. But for right now, follow this sequence. It will make this a much smoother transition. Your body will retension in a way that will make this pain go away, and it will make it to where this doesn't hurt as bad as what it probably did at another given point. So again, just take this dogmatically right now. Just trust my dogma. It will help you. Really try emphasizing that breathing. It will relax you even more. Again, just helps you melt into that ball a little bit better. Squeezing the glute a little bit on this side, a little bit of gluteal activation on that same side. That contract activation will lead to hopefully somewhat of a deeper and better release on the left side. Not necessary though. Really try zeroing in on top of that lacrosse ball. All right, hit that 2-minute mark. We're now going to attack the gluteus medius, which is really the area that we're going to focus on will be the upper glute, the upper butt cheek, kind of right around this area. This area. So the way that we're going to locate this one is you're going to go to the side of your pelvis right here like I am right now, and then you're going to track all the way to the back side. You're going to hit the ridge of your pelvis on the back side. Just keep feeling. And then eventually you'll feel a little bit of your lumbar spine muscles, but it's really just this groove. What you're going to do is get to where that groove is and then just drop your finger down maybe about 2 inches. And you're going to find the pocket of tissue that seems to be the most commonly tight on most people. And the areas that I'm going to be most concerned about when it comes to you guys doing your release will be the fibers that are lateral on your bodies. So as I stand here, it will be the tissues right here. Everything that's lateral. Mainly because when we begin to lose that intra-abdominal pressure and we start shifting our pelvis forward because gravity is dominating us, as I explained in week 1, what we end up then having along with that when we walk are these frontal plane lateral translations, right? As our legs lose the ability to do this function, these flexions and extensions, our body then every single time that we take a step has to do this. Every step that you're doing is involving that kind of an action, and that puts a great dependency of tension on these outer glute muscles. These suckers take a beating as a result of this, these lateral tilting, lateral shifting compensations that we make through the body. And it's not the problem that the lateral tilting is a bad thing. It's an empty lateral tilt, and most people when they land are doing this very empty lateral tilt, and it leads to a whole lot of problems. So we're going to get right there to those lateral gluteus medius fibers. Okay, so I'm going to attack them by going, again, right from that point, dropping my finger down. I'm going to put the lacrosse ball there. Again, the fibers run vertically here, so what are we going to do? We are going to strum the tissues through a cross friction. We're going to go across the fibers here, okay? I'm going to lay down in this fashion here, turn my body to the side, set my timer, and I'm going to let gravity kind of do the talking for me. I'm placing my right heel on my left foot in the fashion that I am right now, and I'm going to just let gravity kind of let this settle in right now. Put the cell phone aside for a second. And by the way, don't put your cell phone in your pocket. It's not a good thing to do. I don't typically do this. This is how what's feeding my microphone right now. So don't do that. I don't do this typically. That's a reminder. I think in about 20, 30 years, people will be looking back on why were you putting something that was allowing radiation to go near your genitals. Not good at all. So definitely don't put your cell phone in your pocket. So I only have that right now simply because it's feeding my microphone. But yeah, we're just gonna go here, moving back and forth through those fibers. Look for that knot that I was talking about before. Look for the knot, pin it down like this. Don't slide off of it. Don't slide off of it. Stay right over the top of it in the way that I am right now. So don't bounce. No bouncing on the fascia. Pin it down. These are moments of time where you can also reflect on your day, relaxing. It's always best to do this in a quiet room. The more noise, the more distraction that you have, typically the less introspective you become and the longer it takes for your fascia to release. So if you can kind of do this in a quiet room as I am right now, when you lose that sound, that feedback, it gives your brain nothing to respond to. So if your brain is no longer responding, it's quite likely that you are going to create a much faster release. Remember, the stress reactions are what make fascia really tight, right? So that there's no noise, it'll be much, much faster. Anything that'll help you relax, whether it's listening to like theta waves or alpha waves, gamma waves, whatever that may be, or if you're listening to very relaxing music, whatever it is that makes you feel good, try doing that, and that will help release the fascia a little better. Just don't do anything that's really gonna stress you out, okay? So we're going to attack the other side next. Going to lay down, placing my leg over the top over here. This side's definitely more tender on my glute med than the other. And this is primarily because my right lower glute on the lateral side doesn't tend to work so much because my hips shift off to the left. So my lower lateral gluteal fibers don't shift my pelvis to the left, and they don't tilt the pelvis to the right either. So my hips are not being pushed over to the right. Now my upper glute meds have to work like crazy to stabilize the right side of my pelvis. Some tidbits of information I'll give you guys on myself. I'm always a student of the game. I'm always trying to fix my own dysfunctions. I got into this just because I've always had my own problems with my own body, and a lot of times people ask me how I've developed a lot of my craft. Most of it's just because I've had physical problems with myself, whether it's pain, anxiety, things along those lines, and I've had to learn how to overcome those things. And accessing these, how to resolve these problems has been through the body. I've done it kinesthetically, and it seemed to have worked pretty well. I dealt with issues of anxiety. I don't really deal with them too much anymore. I think we all still have problems, but this is a very, very good way of it helped me self-remedy my own problems. So I always have some interesting insight about myself. I'm always working on myself. I'm always my own project. And that's one thing I always remind you guys: put yourself on video doing your releases, doing your not your releases, your movements. So if you start practicing the functional patterns movements at any point, best thing you can do is videotape yourself, self-analyze, and ask yourself, does that really look right? And that'll kind of open the gateway towards you solving your problems within time. Okay, we're going to move on to the next myofascial release technique, which will kind of be the lower continuation of the areas that we were just hitting. We were just hitting the myofascial release of the tensor fascia lata, which was right here more on the anterior part, 45 of the hip. Then we were hitting the glute med, which is a little bit lateral, posterior side of the hip joint. Now we're going to attack the anterior 45-degree angle at about 1/3 of the way down the thigh. So as I stand up right here, we're going to be aiming around right here. Okay. This is a very, very pivotal point on the body, one that very few people tend to focus on. This is one of the most important parts that you'll hit on your body in regards to your lateral shifting. There's points on your body that are going to be red tissue. There's points on your body that are supposed to be white tissue. Your body should primarily, in terms of its movement, be oriented by red tissue, which is your muscle. This area right here generally tends to be all white tissue. And that's mainly because people don't rotate very well. They don't use the entire fabric of their fascia and their muscles together very well. So when you begin to lose the connectivity, especially of the opposite side of your adductors, a good functioning activation of your adductors, it's quite likely that these tissues out here are going to become almost like a rock. At one point in my life, I was doing Muay Thai, and I couldn't feel anything, even my skin right here. Now I can feel it once again, but it's because I was taking so many leg kicks, brutal leg kicks from a man named John Exalvez. I developed these huge knots on here, and then eventually I couldn't even feel my skin. But little by little, as I started breaking this area up and balancing out my fabric, I've been able to regain my sensations back in there, and now it's not numb anymore. And my brain can recognize it, and now I don't feel like I have too much restriction there. This is one of my biggest restrictions. I generally tend to tilt this way because I would box moving this way. So then moving this way almost became an impossibility. And now I can kind of get a little more length there than what I did before. Now I don't feel so much restriction on that IT band anymore. So this spot right here will be one of the most important that you hit. You might begin to feel your legs shake. You might scream. Get a really soft ball when you first do this because it's going to be very, very painful. But the reason it's tight, just think every single time you land in longitudinally, you're compensating doing this kind of stuff. The reason it's going to continue to be tight is simply because you're kind of just flimsily landing into your stride every time you walk. I can't really do it so much with my body because it just doesn't do that anymore, not to the degree that it used to, but this area is the one having to take the toll, and it's really, really tight connective tissue that's keeping that together. So we're going to attack that right now. Be very, very careful that it doesn't look like the tensor fasciae lateral release, and I'm going to explain that right now. So I'm going to lay down not face down, I'm going to lay down almost at that same position of the tensor fasciae lateral release, how I am right now. And instead of laying and leaving my posterior leg on the ground, I'm actually going to lift my leg up and then roll further forward on this ball and just go down lower. So it's really the weight of my leg that's actually creating the release point or the gravity or the weight for this release point to happen. So what you're going to do is it's not completely lateral, it's not completely anterior, it's about a 45-degree angle on that outer thigh. Can you see it there, Johnny? Okay. So hopefully you guys can see where that ball is at. Okay. So this would be 100% lateral. You guys see where my foot's at? This would be 100% anterior. See my foot's pointing to the floor. My foot's going to point at about a 45-degree angle. Depending on how bad your external tibial torsion is, the foot may not be the best indicator. It should actually be the knee, but for me, that's what seems to be fairly accurate. So I'm going to hang out here, and you may begin to feel your legs shake and tremble. Again, this is all measured in the millimeters. Oftentimes I have to instruct people this in person because it's very comfortable to avoid this. Other releases that you can do, if I was to make a top 5 list, this will be part of that top 5. This might be number 1 on your body. If you want to talk about an anchor point that you're probably going to have with your body, this could potentially be it. That upper 45 is really important. I will also say, however, if it doesn't feel thick here, stay away from it. You want to, anytime that you attack a release point, it should feel like a thick band of leather that you're on. It should be painful typically, but if it feels like a thick band of leather, you need to release that. If it's really, really thick. If you release this area and it doesn't feel so thick, I would stay away from it. It means that you don't really need it there. You might actually need it lower. You might need to go closer to the knee joint if you feel that on that. That's just a rule of thumb. That's just something that you need to follow. Again, it's that origin to insertion, insertion to origin relationship. I won't go into it, but again, if it feels thin and there's not any tissue there and it hurts, then if it doesn't feel thick, you can move down lower and see how that feels. Aim for the thick tissues, the leathery tissues. Right, we're gonna move to the other side. See if I can keep this one in, keep the cell phone in the pocket. Okay, back leg is off the ground. I'm just laying down. The weight of my leg is doing the work here. Setting up the timer. And we just relax over that point. One of the most fundamental points that you can get on your body. One of the strongest anchors that you can attack on your body. It's amazing what a good minute of breathing can do. I was feeling a little bit of pain there. Just did the breathing a little bit. And I'm kind of floating around here a little bit now. Just sit in, relax the best you can. If this is really painful the first time, I promise you, the pain will subside. Something else to consider, when you start doing trigger points like these, you will feel DOMS, almost like when they talk about delayed what I think is onset muscle soreness. You will end up getting sore like if you just worked a muscle out. If that's the case, don't do this 2 days in a row. Wait until the soreness subsides substantially, then you can attack it again with the myofascial release. I want you guys practicing this stuff 5 days a week minimum, 1 hour a day, but if you feel that there's an area that's sore, just move on into the other one or double up on another spot in your body. All right, so now we're gonna move on into the posterior 45-degree angle. You know, the posterior 45, it just gets tight because it's counteracting the anterior 45. So simply put, it's that same longitudinal pressure creating the hyperextension in the way that I have it right now. And give you guys a lateral view for that. So as I'm hyperextending in this fashion, moving this way, again, the femurs are either going to jet in or jet out. And they can move in a wide variance of different ways. I'm not going to explain all the stuff to the insertion to origin stuff. But these areas right here in general tend to get really, really tight because we're still involving that lateral movement compensation. There's still like a lateral shifting, empty lateral shift, empty lateral tilt happening in that lower body. And so that's creating a tightness on the posterior 45. So before we were going anterior 45, 1/3 down the femur. Now we're going to go posterior 45, 1/3 down the femur. It's going to be maybe about, I would say maybe about 1.5 inches, 2 inches from your glute max. So if I was going to grab the bottom of my butt cheek, which is around right here, it's going to be maybe about 1 inch or 2 just below that. That's where I'll be aiming here, okay? So set up my timer. The way I'm going to set this one up is I'm going to sit down like this, in this fashion. And I'm going to just try and get to that posterior side in the way that I am right now. Very simple. I'm letting my weight fall over the top of that posterior point. I can even turn my leg in a slight bit, and I'll get in there. That one can take your breath away. And keep in mind, every muscle in your body typically, unless you're under a very extreme case, the tissues will, let's say your femurs, don't just externally rotate. If you walk, there's a point in which the femurs are going to externally rotate and then internally rotate. It's to what degree are they rotating inward and they're rotating outward. Sometimes the femurs will rotate out really, really far and just get enough rotation inward to get your knees to neutral, but the knees can never actually move inward past neutral. And your joints should have that capability. So if we're talking about spectrums here, let's say this is the center of the spectrum, this is one extreme of the spectrum, this is the opposite extreme, your muscles need to be able to move back and forth this way through the entire spectrum, right? Most of you are stuck at one end of the spectrum. We need to approach the opposite end of the spectrum. So right now, for many of you, if you have a crazy internal rotation of your femur, you may think, well, you know what? this doesn't make sense to release because the knee dives in. But no, there's actually a point in which the knee needs to actually go out, and it actually needs to come in from that outward position. And this tension right here is going to impede that inward rotation once you get that external rotation. So again, that kind of gets a little bit detail oriented. That's kind of more for the physical therapist level thinkers or people that are educated at this point. But it's just something to consider, that these points need to be released whether you like it or not, even if it makes sense or not at this given point. So yes, these fibers will be ones that abduct the femur. They also externally rotate the femur, but they will also impede internal rotation at a given context. That may have gone over a little bit of your guys' heads, but just trust me on the fact that you do need to release this point along with the anterior 45. You need to get into those points. I found this to be the case with just about every person I've ever trained. Okay, I'm going to get into the other side. Like so. Reset the timer. And I'm getting in right at that posterior 45 once again. And just think there's a lot of specifics that come along with doing these training practices. Things are being discovered every day. So one minute something is fact, and then the next minute it's not fact. So if it was 3-4 years ago, I would have told you not to release one side or the other. But as you go along down this path, you begin to realize that this is much more complicated than what you may think, or what you were anticipating it would be. So again, just chase that pain. Don't run from the pain. Go to it. I'm trying to find some here. This generally tends to be my better leg in this area right here. But try finding what's uncomfortable. The key point is with myofascial releases, we chase what's uncomfortable. Just stick to it. The pain's going to be there. But pain is just a transition to change. Don't worry about it. Don't run from it. It's going to be all right. No reason to worry. Just let the tissues melt. Do your breathing. All right, we're going to move on to the next point, the calves. We did one with the calves last week. We're just going to up it with the lacrosse ball. Just think with the calves. You're standing and you're typically on the balls of your feet. Odds are your calves are not working. They're particularly not working very well from your plantar fascia yanking down. So I could have the calves work like this, right? That's the calves pulling from up here to move my foot like this. Or I can have the calves work from my toes to push me backward, as you guys just saw me do that, right? So we can do plantar flexion like this, or we can do plantar flexion in a closed chain. You guys will see how that works. Most of you are not capable of doing that typically, right? So I really want you guys to pay attention to getting that release on your calves. Many of you that have an anterior shift, oftentimes that can be facilitated from your calf muscles, okay? Based upon how you dorsiflex or plantar flex. And again, we're just looking for that joint stacking. We'll go into that stuff later on down the road. But again, we're going to put that right on the calves like we did last time. Another 2 minutes. Just get in there, bring the leg over the top. This is another fantastic calf release. This one just gets in a little bit deeper. For me, again, I have that upper calf problem on this side. Whew. And again, don't be so, if there's one thing that's always common with people with these practices, is they get discouraged by the pain. Don't get discouraged. Within time, it will subside. You will adapt to it. It won't stay like that forever. the body will eventually say, well, you know what, I have to make the adaptations. Or if the program design of the practice that you have is not good enough, then in that regard, the body may not make the adaptations. But just through this first 10-week course that we have at FP, if you employ it correctly and if you follow the order of which I have my list set out, then your body will adapt. It will not respond the same like it did before. It typically responds better. We have a very, very good track record in what we do. So don't run from that pain. Make sure, and I'm going to keep driving this point home in terms of these first 3-4 weeks, mainly because people tend to run away from the pain with myofascial release. It's convenient to. Don't do it. Go towards the pain. The more that you hesitate to get those release points and break up those anchors, usually the less progress you end up seeing with yourself. So really attack it aggressively. Don't withdraw. Again, I'm going right here. I like to generally tend to go cross fiber, or cross friction, excuse me. Kind of just go back and forth. You can even begin to play around with potential 45s on the calves as well, or there could be an internal 45 or external 45. That's up for you to play with. Okay, that's really where you're going to be at in terms of specifying what you need to do for yourself here. So as I'm here and I'm breaking up my tissues, I'm just exploring. Myofascial release is self-exploration most of the time. You're beginning to find out what's wrong with you specifically in given areas, and you're just understanding, okay, what's actually wrong with me? What's going on? And what's going on with me? There is no, again, there's guidelines, but ultimately you have to find the path towards alleviating your own problems. It's all on you at the end of the day. Forty more seconds. All right, we're going to move on to releasing the gluteal fold. It's that same one, right at that lower butt cheek, lower glutes. If I stand up, it's going to be these areas right here that we're going to attack. We're just going to do a little bit more of an intense version of it with the lacrosse ball. That's going to dig a little bit deeper. It's going to be a little bit more invasive. Again, this is going to help us deal with that longitudinal hyperextension that we've adapted, right? It's vertical pressure making us do this, right? The anterior shift that we see so commonly this way, okay? So we're gonna get into these fibers here, break that longitudinal compensation. Hopefully that'll help us get that pelvis back a little bit and help us decompress that spine a little bit, okay? So we're gonna get right here, right underneath that gluteal fold, set my timer up. Very difficult to see right now because the shorts are blocking it, but hopefully you guys can see where it's at. We're just getting right over there where that lower butt cheek is. Be very careful that you don't feel numbness in your leg or anything like that when you're here. The sciatic nerve's right around this area. Just wiggle back and forth. Don't do this statically. Otherwise, you might begin to feel a little bit of numbness in your foot, which isn't a big deal, but you don't want to, I'd prefer that you guys don't get that. The more comfortable this is, the better for you. So just kind of glide back and forth here, as I am right now. And that will give you all that you need to break that stuff up. You can just look for a chord. It's almost like if any of you guys have ever played a guitar, or just visualize a bassist playing a bass. It's like you're just strumming across the tissues, but you're not going all the way across the tissues. You're just going enough to kind of strum back and forth. So I'm feeling a chord, and I'm just going back and forth on that chord right now. Trying to hold as much of a neutral spine as possible, retracting the navel. And we just do work from there. Just try relaxing. It's almost problematic trying to do an instructional video. This is making me relax. It's making me almost too tranquil, so I'll try and stay awake while I'm doing this with you guys. This is not typically something that I do when I instruct. I'm not typically releasing. I'm usually instructing. This is actually a very new experience for me. Got about another 15 seconds. We'll move on to the other side. But you should feel a great sense of tranquility as you begin to apply this. And just notice how little movement I do with my body as I go back and forth. There's not a lot of movement. It's very small, very subtle movements that I'm doing with my body. No big ranges of motion. I'm not doing anything crazy. It's all the subtleties. Nice deep breaths. The more prolonged you can make the breath, the better in certain instances. So. Got another 30 seconds left. All right, going to move on to the next point, which will be for the upper abdominals. We're really going to try and put an emphasis on the upper abdominals. Just think that when you have an anterior shift, spine's being compressed, oftentimes the point between this section of the abdominals and this part of the rib cage, there's going to be this shortening, this kyphotic flexing that ends up coming along for the ride, and you end up needing to break up the tissues right here in this upper abdominal region. So what I'm going to aim at right here is right here between the linea alba. Right here in between, that is the linea alba. You can release in there, but most of you probably shouldn't. Most people usually have a split linea alba, or oftentimes it's a result of people having a hernia. It's a result of this split in the linea alba, and that's because the slings aren't wrapping around the spine. So for most of you, I would stay away from the linea alba. So stay away from that for right now, and we're going to just aim just right underneath right here where this upper part of the abdominal section is. Xiphoid process is about right here, this bone. Do not touch that floating bone. You're going to hurt yourself. There's no reason to touch bones here. We're just trying to manipulate muscle tissue. So we're going to go right around here, right around here. That's going to help us address this kyphosis, right? This forward flexion that you typically end up happening. Some of you may end up also needing to do some release work on the lower abdominals. Usually it's about a 45-degree angle this way off of the belly button, where I tend to find a lot of pressure with people. People with issues with digestive problems, usually they end up having this problem right here at this 45-degree angle off of the belly button, right? The descending colon is located right around this area, and sometimes there can be some binding going on from the visceral tissue onto the regular muscular tissue. Okay, so we're going to try and get here into the upper abdominals. If you want to explore and come down here, just be gentle when you explore down to the lower areas. This one's going to be a little harder to break up. And again, I'm just going to be taking the lacrosse ball, bringing it right around this section of the abdominals. Okay, just trying to emphasize this right now because you're not going to really be able to see it when I'm on the ground, unfortunately. But you just get here, just break that sucker up. Okay. So I'm going to just lay down face down in this fashion here. Set my timer. And typically I usually just like to I can either bring 2 hands up or just bring my 2 hands down and just kind of hang out here. I just kind of hang out here. I like to almost extend my T-spine a little bit while I hold this. I just don't over hyperextend it. But I'll kind of just try and sit here and just relax and allow gravity to kind of do its work. I'm just opening this up so you guys can see where I'm at. So I'll just put my pressure in here. Be super, super gentle here. The body anchors a lot of its stability off of this point. The upper abdominals in general are a point in which, because people don't have TVA function, they have to use rectus abdominis function to hold it together. And right now, what we're doing is we're taking that dependency away almost entirely. So we're just going to get in here, palpate the tissues back and forth. Just breathe. If you can't think about breathing into anywhere, breathe not where the abdominals are here. Try breathing just above, at the anterior breastbone. Just think about emphasizing your breath right there to that area. So as you breathe in, you go right into here. If you do that, you'll probably feel a significant expansion of those tissues there. And also think that if you have restrictions breathing, if that anterior part of your ribcage is crushed and drawing your sternum downward, breathing in and sending that ribcage up is going to be much more challenging. So this restriction here, switch sides, this restriction here oftentimes will be something that hinders your breathing capability in general. It usually forces people to start breathing into their abdomen, especially during functional activities, which is one of the worst things that you can do with your body. The ribs are flexible for a reason, and it's because our diaphragm is supposed to project our ribs outward, and the ribs are supposed to expand. So when we think about functional breathing, breathing that relates to movement, we got to think about that the breath needs to orient from the rib cage. You orient your breath through the rib cage because it also helps you put pressure in your thoracic cavity, which stabilizes your T-spine, and then that also facilitates a potential activation for your transverse abdominis, which is right below there. So you're essentially riding on air pressure whenever you're exercising, and if your air pressure is going through your abdomen, you're losing that. And you're going to very significantly squander how far you can actually go with your body. As I'm releasing this right here, I'm opening the capacity to develop that air pressure. By releasing this, the body will then be able to retract through the TVA in this section, not through the rectus abdominis, and then the rib cage will be forced to expand a little bit better, and then your mechanics should follow along for the ride. So just hang out here, do work. And again, follow these releases in order. Do not skip the steps. 20 more seconds. let's move on to releasing the pectoralis major. Okay, so we're gonna go over here to this post. And the way that we're gonna break into this pec major is by placing the lacrosse ball right here. And I'm gonna go at about a 45-degree angle from where I'm at right now. And I'm just gonna apply my pressure there. I can open my hand this way. That should expose some of the fibers. Okay, so you can expand that out and apply your pressure here. Just don't get crazy with that mobility stuff. Again, we're trying to get deep layers of the pecs, almost down to the rib cage. If you get it just right, many of you will feel a referral that goes into your right rhomboid region. It'll happen all the way back here. You might begin to feel like a referral that happens there. That's a money spot if you can find that. If you can start feeling muscles twitch, if you guys go on my social media outlets, I show this all the time, where muscles begin to twitch, that's an indicator of something really good going on. It means that the body's fighting its old obstructions. It's when you start releasing this, if I start feeling that pain or a little bit of throbbing that happens in the tissues, usually what that just means is that the old tissues are wanting to hold on to it, but by you applying this new pressure and instituting this new feedback, it's this one saying, okay, I'm going to dominate, we're going to change the pattern. So if you can get some of this kind of shaking sensation out of the muscles, you're going to be golden. And the pec major is one of them where you can kind of get this a little bit if you really concentrate on it. Of course, this is a kinesthetic thing. Much of this stuff are things that I have to show in person. It's very difficult to discuss this through verbal communication and even through showing it visually. It has to be felt. This is a kinesthetic thing. So I'm just doing the best that I can to explain this to you guys. Okay. We'll go ahead and switch sides. This time we'll be coming here, bringing this out. And again, that pec major can also be inhibitory on your breathing. If the pec major is dominating and pulling the humerus forward like this, in this fashion, as that shoulder comes forward, the serratus anterior closes. It closes in and it shortens the pressure here. That also will facilitate the subscapularis, the shoulder blade. It's going to end up sticking to the backside of your rib cage as well. So as this whole thing sticks that way, and then that also creates this shortening of space between your ribs, it creates this whole cataclysm of poor breathing patterns. So as you begin to break up this pec major in the way that we are right now, that's going to allow your shoulders to come back a little bit. Now, it's not to say that bringing the shoulders all the way back is a good thing. Then you can create an opposite dysfunction in the serratus posterior, but we're not going to talk about that. But we want there to be kind of like a balance between your retraction and your protraction. You want to be a little bit centered. It's easy to over-retract around the rib cage. I'm just discussing in relation to this happening excessively this way. Okay, so if that's happening and we begin to break this stuff up, that should allow the serratus anterior to kind of come back. And that should open up some space right here on the rib cage, and that should allow the intercostals to open up a little better and facilitate a better stretch in those areas. And that will lead to more effortless breathing. And that's the key point here, is that we want effortless breathing. Breathing should not be laborious. At least deep breathing should not be laborious. You should be taking fairly deep breaths very easily. But if your rib cage is kind of crushed, it's going to be very difficult to get that expansion of the rib cage to really give you that full depth that you're looking for. Okay, we've got about another 10 seconds, and we're going to then move on into releasing our latissimus dorsi, which will be another really important muscle to break up, especially on you males. But it also will be a little bit of a serratus anterior release. So, first function of the latissimus dorsi, and I'll be going on into an explanation of this stuff later on. I also will have this on a separate section on the videos. I'll have it all organized for you guys. First function of the latissimus dorsi is to extend. So this is shoulder flexion, and the first function of the glute max is to extend at the shoulder joint. So I could take the arm out of this, and this could be it, right? I can do it with a bent elbow or straight elbow, or with an extended elbow or flexed elbow. But as I extend in this direction, that's the first function of the latissimus dorsi. Secondary function is going to be hyperextension. Tertiary is typically going to be internal rotation. So the lats typically for most people they operate on secondary and tertiary function. So they operate in hyperextension and internal rotation. And what that usually ends up leading them to do, again, is to crush that rib cage, right? And that feeds into that longitudinal compression that I'm always talking about. Okay, so the way that we're going to attack into the latissimus dorsi is we're going to go right back down to the floor and lay down and go after this sucker. Okay, so what I'll be doing here is laying down on my side, placing the lacrosse ball underneath, right here, literally at the most lateral portion of my rib cage. Okay. So we're going to go straight, completely lateral. So we're not going too anterior, not too posterior. We're going to go almost 100% lateral. These are the fibers that appear to be the most rigid on people. So we're going to go right here. You're going to look for this massive tissue. Now for women, you don't generally tend to have very much muscle here. And this is precisely because women tend to wear sports bras. Women generally tend to not open their posture up very much either because of cultural reasons and confidence things that society kind of places upon them, unfortunately, and sometimes they end up having a very restrained rib cage, and a lot of that's because of the effeminate walking as well. The pelvis drifting back and forth leads to very little thoracic rotation, and that leads to even more crushing of the rib cage. So this area right here for women in general doesn't tend to have very much muscle, so it's hard for them to get releases here. I've found this to be the case all over the planet, and most of it's a cultural adaptation. But you women, ladies, can also get lots of muscle on your lats. You need to have this. You need to have these muscles developed. You may actually need more muscle activation in these areas than you will actual release. For women, I generally tend to find that women, unless they are kind of like stronger in their upper body and they focus a lot on upper body exercise and whatnot, generally need more release in their lower body. But again, I'm trying not to stereotype. These are just commonalities that I tend to find from one gender to the other. So you just get here. You'll notice that my arm right here is in kind of an external rotation. I let my arm to kind of just hang out. I lay down right here at the side of the lat here. It's pretty basic stuff. Just look for the areas that hurt, guys. And again, if this is very bony on you, get a tennis ball. Get something really soft. If it's all bones, then I would still recommend releasing a little bit, but just with something that's very soft. You can also put a cushion on your head if need be, and that can also help you along this path towards trying to stay relaxed while you're doing this release. So we'll kind of just get in here, breaking that stuff up. Be sure to not avoid the lower lats, okay? Get low, fairly low on the latissimus dorsi as well. Okay, so we're gonna get to the other side. Again, right here, just literally 100% lateral, looking for those pockets of tissue. You guys will see how I got this muscle here. You wanna get right to the center of that and penetrate downward laterally towards the rib cage, okay? Set my timer one more time. Okay, I'll set my hand over here to support my head. And pay attention to which one feels more dense. I generally tend to find that people who are throwers, anybody who's done any kind of throwing sports, or if they've done any boxing, and if they're right-handed, their left lat tends to be a little bit thicker and tighter, and their right lat a little bit the opposite of that. And that's the case for me. So I've noticed that pattern on myself, and I've seen it replicated on many, many other people. So you may have the same thing if you happen to be a person that's been involved in athletics and threw a lot. So just get in here. I can even go into a complete fetal position, extend out my legs. It's really whatever you guys are comfortable with here. Back and forth. Still got about 40 seconds left. Let it sink in there, sink out. Feel a little tightness, on your shoulder, it's because, and you feel like your hand's up here, it's because you got really, really tight lats and really tight pecs. So your hand should be able to drop down fairly easily. So you guys will see mine just drops down. My hand used to do this. Again, this will change with time. We just have to emphasize these release points, really practice them on a daily basis. Not that I'm a particularly great athlete now, but comparatively to what I was 10 years ago, I've become way more athletic. Always had coordination, but I never actually had explosive capabilities. I was never really able to do a lot with my body, and I managed to transform it into that by just being patient and allowing these releases to do their work. We're gonna do one more release for this video, and we're gonna go do that right back on that post. We're gonna hit the upper traps. So I'm gonna be hitting this over here, like so. This arm's gonna be hanging down in this fashion. Okay, that's gonna be kind of the position. So just think we're going at the upper spectrum to the trapezius. So as the rib cage begins to shift this way, shoulders are gonna wanna elevate. I look at the points that elevate at the top here. So I don't really put a lot of emphasis on the traps on the posterior side. Usually those are areas that don't need to be released. Those are areas that need to actually be contracted. They need to be contracted from the spine to be pulled back this way. Not gonna get into that quite yet. I'm more concerned with you guys getting the release going straight downward right here at these upper traps. And again, these are just areas that generally for some people, they will tend to rise up as they shift forward, okay? Many of you will also have a scapular depression. If you're a person who notices that there's a great distance from right here where your AC joint is to your ear, based upon how it is kind of like in this position, then I would suggest that you don't release this too much. But for those of you that feel like you have kind of like a rising in your scapulas, this may be a point that you want to hit. Okay, so I'm going to be right here, facing downward, set my timer, just be bending down, kind of letting the strength of my legs push me forward. This one generally tend to hurt pretty well, but pretty bad. But the relief that people usually get is pretty substantial, especially for those of you who sit at a desk all day, who are kind of always shrugged up, who probably don't have the most ergonomically friendly desk station. This will probably be an area that gives you a great sense of relief. And again, if any of these points hurt too much, always regress down to not a lacrosse ball, a tennis ball. And if there's something even softer than that, even like a racquetball, something like that, if that's more convenient for you or it makes you feel better so where you can transition in, feel free to do that. Take your time. But with that said, push your boundaries. Make sure that it's still uncomfortable. The key point is that this remains uncomfortable. You don't want any of this stuff to, when you find comfort, it's where plateaus exist. At FP, we don't have plateaus. Nobody ever plateaus. We are always getting better and better and better. I've been at this for about the last 9.5 years, 10 years, and all I do is get better. I'm always progressing. I've never had a plateau. I'm still getting better. I'm age 32. I'm pushing on 33 now, and I feel better now than I ever have in terms of my neuromuscular system. I feel more connected than I've ever felt. And it's just a result of me continually trying to push that envelope, always trying to find the right kind of discomfort, the right amount of discomfort. So if it's too much and you're feeling like your body, your muscles are kind of beginning to tighten up, then you don't want to go to that point. But it should be the right kind of. It's not always about just pushing the envelope. It's about pushing the envelope in the right way. And that's the point that I'm trying to make here is give yourself the right amount of discomfort, but make it uncomfortable. The more uncomfortable you become, the further you advance in this life. Adaptation in nature was never comfortable. Lions don't hunt because they like it. Lions hunt because they have to do it. Let that arm hang. Just kind of let the weight of your body fall forward on that, depending on how much pressure you can take. About 1 minute left. Just kind of hang out there. Trying to get in a little bit deeper now. I feel like the superficial layer is kind of loosening up, and now I'm getting into some good deep stuff. Still got 30 more seconds. That feels nice. Just think about breathing, trying to stay as relaxed as possible. You need to switch your feet around so you don't get too tired. You can also have a stick here if you like. I've played around with that, even having a chair here. You can do things like that to make this a more comfortable experience. And keep in mind, this isn't necessarily a release that I typically stick around for more than about a minute, but for the sake of staying on schedule, we did it for 2 minutes. Give it a little bit more. Feels very nice. That is week 2. Practice that. Stay on top of your myofascial release. This is going to be very pivotal in terms of what you're going to be doing for the corrective exercises that we're going to be doing moving forward from here. There's going to be a lot of muscle activity happening later on down the road. This mobilization needs to be happening. If you try doing a row and you can't retract your scapula, right, and you can't expand your rib cage with that scapular retraction later on down the road, it's because you have a blockage. Right? The pec major is holding that back. The serratus anterior is holding that back. The latissimus dorsi is holding that back. If you want to get a better lat contraction and increase the range in which you're going to fire that lat in terms of a functional capacity, you can't have that while you have these blockages around. So we have to eliminate these fascial restrictions to get us there. Again, there's other ways of doing this, but again, that takes a much more specified approach. This is a way that tends to work for most people as long as they practice it. So do not overlook the myofascial release. Don't get so caught up in the go, go, go mentality of training. It's very easy to get wrapped back up in that. Focus on this for at least 2 months if you can, right? But if you want to follow it week by week, that's cool, but don't skip steps. There's also times where if you're going to want to advance yourself along, you're going to have to come back to myofascial release anyway. You're going to feel the restriction pop up and be like, you know what? I kind of feel like a tightness in my shoulder now that I didn't have before. Let me release my pecs again. Let me release my subscapularis. Let me release my lats. You're going to feel those types of things eventually anyway. So there's no way that you're not going to be able to. There's no way you're going to escape this stuff. Once you try exercising, new things pop up, new problems emerge, and it's very important that you guys make sure that you're prepared for that. So this will be your best friend for quite some time until you begin to fire your muscles correctly. I will see you guys next week. Take care.